form, again, this part can come as a short note separately, or it can be a big question. Is that form of a conventional preparation that prevents or resists displacement or removal of the restoration from lifting or tipping forces. So retention form, most of the students in the bio will say, it is that form that retains the restoration. No, it hasn't to be answered like that. It is the shape or form that is given to the conventional preparation that will prevent displacing or removing or prevent displacing or the restoration from coming out of the cavity due to tipping or lifting forces, right? This is retention form. Now, how do you achieve this? Now, before that, very often students get puzzled between resistance form and retention form. They are very separate entities, but very often the features which enhance retention form might also enhance resistance form. So, actually, they are two different things, but the factors, sometimes they can be used for both, right? So you don't get puzzled. Resistance form is the shape given to prevent the filling and the restoration and the tooth from fracturing during mastication, while retention form is the shape given so that the filling does not come out of the cavity due to tipping or lateral forces or occlusal forces. It's very, very simple, right? So how do you achieve the retention form? The retention form can be achieved by a box form, then convergence to the occlusal surface. That is, you have the floor diverging while the occlusal surface converging. You can make retention grooves, you can make pins, slots, dovetails. These first five essentially you will agree are mainly for composites. But if you're the first five are for amalgam, but if you're doing composite, then obviously you need acid etching or resin composite restoration, right? So here you can see in a class 2 tooth preparation, the external walls, you can see the base floor of the cavity is divergent while they are converging occlusally. So that this becomes an undercut, right? But when you are doing an inlay, right, you cannot have converging walls. You have to have almost or near parallel walls. So because the inlay is an extracoronal restoration, you put it in and you take it out. So if you have undercut, you will not be able to take it out. And you have to have straight, free-flowing walls because you have to put the inlay in and you have to cement it in. So definitely for amalgam, you require to have occlusal convergence, pulpal divergence, while for inlay, you need to have near parallel walls or maximum 2 to 5 degrees of slight amount of divergence. This is very, very important. You have to be very, very particular about this. Right? Now, having understood the main or the essential features or the primary features of resistance form, let's go on to the convenience form. The convenience form is that form of the cavity that will provide good observation, accessibility, and ease of operation in preparing and restoring the tooth. That is, you will give it such a shape, the design you make it in such a way, the shape is done in such a way that you can visualize it properly. You can access it, so your instruments can go in and come out, and because you can access it, there is ease of operation in preparing and restoring that tooth. Okay? So, the examples of convenience form, right? On occasion, when you're obtaining this form, it may necessitate extension of the distal, mesial, facial, or lingual walls to gain adequate access to the deeper portion of the preparation. In class 2, extending the proximal preparation beyond the proximal contacts might be required. Now, in gold foil, establishing convenience points for the starting of foil condensation. These are all things that you might need to incorporate in your cavity design for you to be able to complete the restoration in a convenient form. Then your next step is removal of any remaining enamel, pit and fissure, infected dentine and or restorative materials if indicated. So you must remove all the old restorative materials if there is anything. Now, all that will affect the aesthetic result of your new restoration. Old materials that is compromising, needing detention. Like if old glass ionomer restoration, They have a weak bond to the tooth and the new composite restoration using enamel and dentine bonding. Take an X-ray to see that the caries, if there is caries under the old material, all this should be removed. The tooth, whether there were any signs or symptoms beforehand. If it was asymptomatic, good. But that might also mean that maybe the tooth is non-vital. So in the X-ray, you have to see whether the decay was very deep near the pulp or it is hitting the pulp. So you have a filling. Below the filling, there is secondary caries. And that caries might have gone into the dental pulp. So all this you have to see by the X-ray, because otherwise you will start removing the filling, you will start doing all that thing, and you will end up with a condition where you will have a problem, right? So you have to be very, very clear about all of this. And then the periphery of the remaining old restorative material is not intact. Remove all those, the cavo surface, peripheries, all that thing should be clean. Then after you have done that, then you have to see, well, it's easy to say that the ideal cavity preparation has to be 0.5 millimeters below dentine, below the dentino-enamel junction. But very often you don't get an ideal case. Very often the decay is very deep, but it has not hit the pulp. So it's never that your cavity is going to be 2.2 or 2.5 millimeter depth. It can be deeper still and can be very close to the pulp. So in that case, we have to protect the pulp. We have to protect the pulp from various injuries. Now, Manjusha madam just explained to you that the physical, chemical, thermal causes for pulpal injury, right? So physical is going very deep, and if you're using an air rotor without a coolant, if you don't use the coolant, you can cause heat changes. Chemicals. Now you have to be very careful what cement you're using, because the acid in the cement should not at any point of time irritate the underlying pulp. So I'll be talking a little bit more about pulp protection in my next topic after we finish this. Right? Now, after you have done this basics, then you look at the cavity, and if you feel that you need to incorporate some more resistance and retention forms, that's called secondary resistance and retention form. So if it's a compound or a complex preparation, you might have to incorporate a retention lock. You might need to incorporate a groove. For retention, you need to make coves. So locks, grooves, and coves are secondary retention forms. Here you can see you're using a tapered fisher bird to make a groove in the axiopulpal line angle, and at this line angle between the gingivo-buccal line angle, or you can do it at the gingivo-labial line angle. Okay? So automatically when you say about line angles, the next question the examiner might ask you, define a line angle. So you see a line angle is a place where two surfaces meet. Then they'll ask you what is a point angle. So you say the junction of three surfaces. Once you answer that, then we get more adventurous. Then we'll ask you how many line angles and point angles in a class 1. So we will say 8 line angles and 4 point angles. How many in a class 2? You will say 11 and 6. How many in a class 5? Will be again 4 and 8. How many in a class 3? It will be 6 and 3. And you're getting all your answers right. Then you will get a googly. The googly is how many line angles and point angles in a MOD cavity. And then you start counting. They are 14 and 8. Also, you should know how to name these line angles and point angles. Okay. So these, very often when you answer your Viva questions, your answer will lead you to the next question. Right? Over here you can see how a groove is being done categorically. You can also use pins, amalgam pins. Okay? So you very often get a short note on amalgam pins. What are the different types of pins that can be used in amalgam? So you have to read about that. You have to talk about, I think there are friction lock pins, there are cemented pins, and they are, the third one is retentive pins. So these 3 types of pins, their sizes, their commercial name, all that thing, cemented, friction lock, and the third one, it's slipping my mind. The third type of pin is there which you need to talk about. Okay? So having talked about this, then these are how slots look and coves look. These are slots and cores. These are all secondary retention forms. Slot is the slot done over here. There is the cove done over here. And here you've got locks. Now, then there are, next step is finishing the external walls of the tooth preparation. That is to create the best marginal seal possible for between the restorative material and the tooth preparation. And we should be able to have a smooth marginal junction and provide maximum strength of both the tooth and the restorative material at and near the margin. Right? So, again, before I finish off this part of the topic, your principles of cavity preparations have to be understood from an amalgam restoration point of view, a composite restoration point of view, a glass ionomer restoration point of view, an inlay only, and a veneer restoration point of view. While for an amalgam, there is only mechanical retention. A composite can have chemomechanical retention. A glass ionomer can have chemical retention because they say glass ionomer is chemically bond to the tooth structure, right? The inlay, you're going to have basically cement, which is going to be the retentive factor. Onlay, also same. Now we've got advanced retentive adhesion techniques where we have ways and means of trying to get some amount of chemical retention also. So these points you all need to be aware of